It's usually called tennis elbow. Technically, it is called lateral epicondylitis. And while playing tennis or other racket sports is one possible cause, it can arise from many other activities in which a repetitive motion inflames the tendons and muscles of the forearm. If you have tennis elbow, there are a variety of non-surgical steps that can combat it. If none of these has worked, surgery may be the only answer. Orthopedic surgery is one of the specialties at Lacour Medical Center. With a combination of arthroscopy, the use of a tiny camera and instruments inserted through small incisions, and traditional open surgery, our surgeons have had great success in combating this debilitating problem. In a moment, I'll give you more details on how this procedure works at Lacour. A complex system of muscles and tendons holds the bone of your elbow joint together. When this system is abused by overuse, particularly through certain specific repeated motions, the strain on the muscles can be too great and microscopic tears begin to form. This will inevitably lead to inflammation and pain, particularly when performing the motion that led to the damage in the first place. There are other injuries that can arise affecting the elbow, and they can be dealt with surgically, but overuse injuries are the ones we most often see. While the term tennis elbow seems to limit the problem to aficionados of racket sports, in fact, these repetitive strain injuries are common in other leisure activities and even in some kinds of work that require manual labor. Sometimes the injury can arise for no known cause. The first steps in fighting it usually involve rest, medication, physical therapy, wearing a special brace, or perhaps the injection of cortisone. If symptoms don't abate after all these efforts, surgery may be required. Lacour Medical Center features a leading orthopedic surgery team that employs all the latest surgical techniques and technology. The most common kind of surgery to relieve the pain of tennis elbow is called lateral release surgery, which is an outpatient, single-day procedure at Lacour. The doctor will make an incision in the arm and release the tendon from the bone. Depending upon the surgery, another option is to trim the sheaths of the tendon before closing the incision. Sometimes, the injury can be dealt with arthroscopically, which requires smaller incisions and less recovery time. In any case, you will be able to return home on the day of the surgery. You'll likely have to wear a splint for a week or so, and it may be a few weeks before you experience the lessening of your pain. Beginning a few months after the operation, you will have to begin gradual strengthening exercises to regain conditioning in your arm. Finally, you won't be able to return to the activity that caused the pain until 4 to 6 months after the operation. Properly done, lateral release surgery has a high success rate. Tennis elbow can be a very frustrating condition, not only because it is so hard to overcome, but because it often prevents people from doing what they like or need to do. If you've tried to get over tennis elbow without success and need surgery, in choosing Lacour Medical Center, you can be assured that you will be treated with the utmost professionalism, courtesy, and care. If you need elbow surgery, it's best not to wait. Call Lacour for a consultation appointment today.